The blood pooling under her field jacket should have had her screaming. Instead, hospital corpsman second-class Maya Okonkwo sat perfectly still in the triage tent, her breathing controlled, her face a mask of professional calm. The SEAL medic approaching her bed had seen hundreds of wounded Marines. He had never seen one who looked like they were waiting for a bus. What Senior Chief Vance did not know, what nobody in this field hospital knew, was that Maya Okonkwo had been trained to endure pain that would break most operators. And the shrapnel in her side was nothing compared to where she had been. Senior Chief Derek Vance had worked in forward operating bases for 15 years. He could assess a casualty from 20 feet away, read pain levels in the set of shoulders, the tension in hands, the rhythm of breathing. The young corpsman on bed 7 defied every indicator he knew. Her vital signs showed moderate shock. The blood loss suggested significant trauma. Yet she sat upright, alert, her dark eyes tracking the organized chaos around her with clinical detachment. He reached her bedside and checked the tag hanging from her uniform. Second-class petty officer, 27 years old, blood type O positive, shrapnel wounds to left flank and shoulder. Morphine refused. That last detail stopped him cold. "You refuse morphine," he said. It was not a question. Maya turned her gaze to him. "Yes, Senior Chief." Her voice carried no strain, no tremor. Vance had heard combat veterans force that kind of calm, pushing through agony with pure willpower. But this was different. This was effortless. "Why?" he asked. Maya gestured toward the far end of the tent where a 19-year-old Marine sat hyperventilating, his left leg wrapped in fresh bandages. "First IED," she said. "He needed it more than I did. Kept saying he could feel his foot, even though it was gone. Phantom pain is worse when you are terrified." Vance followed her gesture and recognized the signs of panic in the young Marine. Someone had indeed administered morphine recently. The kid's breathing had started to even out. "You gave him your dose," Vance said. "He is 19, Senior Chief. First deployment. He will need his mind intact when he wakes up enough to understand what happened. The morphine will help him process it without complete psychological break." Vance studied her face. Still no pain markers. No micro-expressions of suppressed agony. He had seen operators try to hide their suffering. Maya Okonkwo was not hiding anything. She simply was not in the same kind of pain everyone else would be. "I need to examine your wounds," he said. "Understood." Vance pulled on fresh gloves and carefully lifted the edge of her blood-soaked jacket. The shrapnel had entered just below her rib cage, a jagged piece of metal still partially embedded. It had missed major organs by centimeters. Lucky, but the removal would be excruciating. "This is going to hurt," he said. "I know." He reached for the protruding edge with forceps, expecting her to tense, to gasp, to show him something human. Instead, Maya Okonkwo took one measured breath and held completely still. Vance pulled. The shrapnel came free with a wet sound that made nearby casualties look away. Blood welled immediately. Maya did not flinch, did not gasp. Her breathing remained absolutely steady, controlled, mechanical. Vance had removed shrapnel from Green Berets who cursed him, from Force Recon Marines who gripped the bed rails hard enough to leave impressions, from Navy SEALs who turned white and shook despite their training. Maya Okonkwo watched him work with mild professional interest, as if he were treating someone else entirely. Before we continue, drop a comment and let us know what state you are watching from. Maybe you know someone who showed extraordinary courage under pressure. Vance packed the wound with gauze, his movements automatic while his mind raced. He had been a corpsman for 2 decades. He knew pain tolerance, knew the difference between bravery and shock, between discipline and dissociation. This was something else. "When did you receive this wound?" he asked. "Approximately 4 hours ago, Senior Chief, during the convoy attack en route Silver." For hours. She had been treating other casualties for 4 hours with shrapnel in her side and shoulder. No pain medication, no implant. "And you continued performing your duties?" he said. "There were 17 wounded," she replied. 3 critical. I was the only corpsman in the vehicle. The timeline was not optional. Vance moved her shoulder wound, smaller but deeper. As he cleaned the area, he noticed other scars. Old rope burns on her forearms, faded but distinctive. A surgical scar along her collarbone that looked like childhood trauma. Things that told stories he suddenly wanted to know. Your pain tolerance is unusual, he said carefully. I have had practice, Senior Chief. What kind of practice? Maya met his eyes directly. The kind that makes you useful in situations where others break. That answer raised more questions than it answered. Vance finished dressing her shoulder and stepped back. You're going to need antibiotics and observation. I'm keeping you here overnight. Understood. Will I be cleared for duty tomorrow? Not a chance. You are off rotation for at least a week. For the first time, Maya showed emotion. Frustration flickered across her face, quickly suppressed. Senior Chief, there are only 4 corpsmen supporting this base. We are already understaffed. I can work. Not with those wounds. You cannot. I have worked with worse. Vance felt his professional concern shift towards something harder. He had seen too many young sailors push themselves into permanent damage, convinced their invincibility was a virtue. Whatever training Maya Okonkwo had received, whatever allowed her to sit through shrapnel removal without flinching, it was making her dangerous to herself. That is not your call to make, corpsman. You are off duty until I clear you. That is final. Maya nodded, but Vance saw the calculation in her eyes. She would follow his orders because she had to, not because she agreed. As he turned to move to the next patient, his gaze snagged on those rope-burned scars again. They were old, maybe 10 years or more. Symmetrical, deliberate. He had seen scars like that exactly once before on an instructor at the Navy SEER School. Resistance to interrogation training. The kind of program that taught people to endure torture without breaking. Vance looked back at Maya Okonkwo, who had returned to her clinical calm, watching the organized chaos of the field hospital with steady dark eyes. He pulled out his tablet and opened her service record. Standard Corpsman School. Fleet Marine Force qualification. Deployment history looked normal. But there was a 6-month gap 3 years ago. No assignment listed. No location. Just blank space where a sailor should have been somewhere. Senior Chief Vance had been in the Navy long enough to know what blank spaces meant. He closed the tablet and walked to the administrative tent, his limp more pronounced than usual. His leg always ached worse when something bothered him. By morning, he would have answers about Hospital Corpsman Second Class Maya Okonkwo. By morning, he would wish he had left well enough alone. Maya woke at 0 for 30, same as every morning for the past 9 years. The wounds in her side and shoulder sent sharp protests through her nervous system as she sat up on the field hospital cot. She acknowledged the pain the way she had been taught, observed it without reaction, and began her morning routine. Senior Chief Vance had been clear. Off duty for a week. But duty was not the same as usefulness. She dressed carefully, moving with precision to minimize the pull on her stitches. The tent was quiet except for the soft breathing of 2 other recovering corpsmen and the distant generator hum that never stopped in forward operating bases. Maya had learned to sleep through anything, but she had also learned that sleep was a luxury, not a necessity. The mess tent would not open for another hour, but the medical supply depot ran 24 hours. She could inventory, organize, prepare kits, make herself useful without technically being on duty. She was halfway across the compound when the memory hit her. Elena at 16, sprawled on their apartment floor, blood spreading across cheap linoleum. Maya had been 18, home from her first semester of community college. She had known immediately that her sister was dying. The knife wound in Elena's abdomen, the pale lips, the rapid, shallow breathing. Maya had called 911, applied pressure to the wound, tilted Elena's head back to keep her airway clear. 17 minutes for the ambulance to arrive. 17 minutes of watching her little sister fade, while Maya's hands turned red and Elena kept asking if she was going to be okay. She died in the ambulance 3 blocks from the hospital. The paramedic told Maya later that if they had arrived 5 minutes sooner, Elena would have lived. Just 5 minutes. The difference between a sister breathing and a sister gone. Maya had enlisted in the Navy 2 weeks after the funeral. If she could not save Elena, she would save everyone else. She would become the person who arrived in time, who knew what to do, who never hesitated. She had kept that promise for 9 years. The supply depot was locked, but Maya had the access code. Inside, the shelves were organized chaos, the usual state of field hospital logistics. She began sorting through the hemostatic gauze supplies, checking expiration dates, rotating stock. "You're supposed to be resting." Maya did not turn around. She recognized Petty Officer James Park's voice. He was the only other corpsman on this base who did not treat her like a curiosity or a liability. "I am resting," she said, "just not sleeping." Park walked around to face her. He was 29, Korean-American, with the perpetual dark circles under his eyes that came from too many medevac runs and too little downtime. He had been in Afghanistan for 11 months. Maya had been here for 7. "Senior Chief is asking about you," Park said. "Pulled your service jacket. Started making phone calls." Maya continued sorting supplies. That is his prerogative. He found the gap. Everyone finds the gap eventually. Park leaned against the shelf. He knows you were somewhere for 6 months that does not exist on paper. He thinks you were in a program. A bad one. Maya met his eyes. "What do you think?" "I think you took shrapnel removal without flinching. I think you have scars that look like training injuries, not accidents. I think you're the calmest person I have ever seen under fire, and I serve with Force Recon Marines. That is observant of you." Park crossed his arms. "My sister died in Fallujah. She was a Marine. Took an IED blast that should have killed her instantly, but did not. She lived for 40 minutes while her squad tried to keep her together. The corpsman with him broke down. Just stopped functioning. Could not handle what he was seeing." Maya stopped sorting. "I am sorry." Park shook his head. "I am telling you because I understand why you do this. Why you push. Why you give away your morphine and work with shrapnel in your side. You are trying to be the person who does not break. The one who saves them. That is the job. No, the job is providing medical care. What you do is something else. What you do is punish yourself for someone you could not save." The words hit harder than the shrapnel had. Maya turned back to the shelves, her hands moving automatically through the familiar task. "Her name was Elena," Maya said quietly. "She was 16. She died on our apartment floor because the ambulance took too long and I did not know enough to save her. I was 18 and I had taken one first aid class and I watched her die in my hands." Park was silent for a moment. "That was not your fault. It does not matter whose fault it was. What matters is that I was not good enough. I am good enough now." "At what cost?" Park asked. "Maya, you have the highest patient save rate on this base. Everyone knows that. But you also have the highest personal injury rate. How many times have you been wounded this deployment?" Maya did not answer. 7, Park said. 7 times in 7 months. You take risks no one else takes. You go into situations we are supposed to wait on for armed escort. You carry casualties twice your size through active fire zones. You are brilliant, and you're going to get yourself killed. I am careful. You are reckless. There is a difference between brave and suicidal." Maya turned to face him fully. The wounds in her side and shoulder throbbed with the movement. "I know my limits." "Do you?" "Because from where I stand, you do not have limits. You have training that lets you ignore pain and danger and self-preservation. That is not strength, Maya. That is damage." The words hung between them in the quiet depot. Outside, the base was starting to wake up. Voices carried across the compound. Engines turned over. Another day beginning. "The program I was in," Maya said finally, "teaches people to survive things that would break most humans. Isolation, pain, psychological pressure. It is not damage. It is adaptation. To what end? To make sure I never fail someone the way I failed Elena." Park stepped closer, his voice gentle. "You did not fail your sister. You were 18 years old with no training in a crisis situation. You did everything you could. It was not enough. It never is, Maya. That is the thing they do not tell you when you sign up for this. We cannot save everyone. The best corpsman in the world still loses patience. You could be perfect, and people still die. Then I will be better than perfect." Park sighed, recognizing the wall he had hit. "I'm putting in for transfer," he said. "Back to San Diego." My rotation ends in 3 weeks. You should consider it too. Get out of theater. Get some distance. I have 5 months left on deployment. You could request early rotation. Medical hardship. Your injury rate qualifies. Maya returned to organizing supplies. I am not leaving. Senior Chief Vance is building a case against you. He thinks the program you were in damaged you. He is going to recommend you for psychiatric evaluation. Let him. Maya, if they pull you from the field, you cannot help anyone. Maya's hands stilled on a package of combat gauze. She thought about Elena, about the 17 minutes that killed her sister, about every patient she had saved since then, every life she had pulled back from the edge that Elena had gone over. Then I will make sure they have no cause to pull me, she said. Park looked at her for a long moment, and Maya saw in his eyes what she had seen in mirrors. The weight of trying to save everyone, the impossibility of the task, the refusal to accept it. Be careful, he said finally. Vance is not your enemy. He is scared for you. That makes him more dangerous than any antagonist. After Park left, Maya finished the inventory in silence. Her wounds ached. Her body needed rest. But rest meant stillness, and stillness meant remembering. She would rather bleed than remember. Outside, the sun rose over the Afghan desert, painting the sky in shades of amber and rust. Another day, another chance to be good enough. Maya Okonkwo returned to her tent, allowed herself 2 hours of sleep, and woke ready to prove that she belonged exactly where she was. The orders came through 3 days later. Maya Okonkwo was being rotated back to Naval Medical Center San Diego for mandatory program evaluation. Not a request, a command. She stood in the administrative tent reading the message on the secure terminal while Senior Chief Vance watched from across the room. He had been the one to initiate the transfer. That much was obvious. You will fly out tomorrow morning, Vance said. 0600 wheels up. Maya logged out of the terminal without responding. Her wounds had started to heal, the stitches holding clean. Another 4 days, and she would have been cleared for full duty. Now she was being pulled off the line. This is not a punishment, Vance continued. His tone was measured, almost gentle. The program you participated in requires periodic psychological evaluation. You are overdue. I completed my last eval 11 months ago. That was before your 7th combat injury in 7 months. The Navy has protocols, corpsmen. I am following them. Maya turned to face him. With respect, Senior Chief, you are removing an effective medical asset from an understaffed forward operating base because you do not understand my training. Vance's jaw tightened. I understand plenty. I understand that the Navy survival, evasion, resistance, and escape program trains people to withstand interrogation and torture. I understand that volunteers go through hell that would break most operators. What I do not understand is why the Navy thinks putting corpsmen through that training serves any medical purpose. So this was what he had discovered. The SEER program. Most people assumed it was only for pilots and special operations personnel at risk of capture. Few knew about the experimental extension program for combat medical personnel, the one that trained corpsmen to continue functioning under conditions that would incapacitate normal humans. The program serves many purposes, Maya said carefully. Name one that justifies teaching medics to ignore their own injuries while treating others. It ensures we do not become the casualty that needs treatment. It ensures we remain functional when others cannot. Vance walked closer, his limp more pronounced than usual. His leg injury always seemed worse when he was agitated. I have been a corpsman for 20 years. I have worked in every hellhole the Navy could send me. I never needed to be tortured to do my job effectively. The word tortured hung in the air between them. It is not torture, Maya said. It is preparation. For what exactly? What scenario requires a corpsman to tolerate having shrapnel removed without pain medication? Any scenario where medication is limited and other casualties have greater need, which is exactly what happened 3 days ago. Vance shook his head. You gave away your morphine because you wanted to, not because you had to. There was enough for everyone. There was enough if we assumed no additional casualties. The convoy attack could have produced more wounded at any moment. I made a resource allocation decision. You made a martyr decision. There's a difference. The accusation stung more than Maya wanted to admit. She had spent 9 years making sure she was never the victim, never the one who needed saving. Vance was reframing her strength as pathology. Believe what you want, Senior Chief. I will complete the evaluation and return to duty. Maybe, Vance said. Or maybe the evaluation will show what I already suspect. That the program damaged you in ways you cannot recognize. That your pain tolerance is not an asset, but a symptom. Maya felt anger rising, hot and sharp. She forced it down using the same techniques that let her ignore physical pain. Breathe. Observe. Compartmentalize. I'm not damaged, she said quietly. Then prove it. Go to San Diego. Pass the evaluation. Come back cleared. And if I do not come back cleared, then you get help you clearly need. Maya studied his face. Vance genuinely believed he was protecting her. That made him more dangerous than simple antagonism. You could fight an enemy. You could not fight someone who thought they were saving you from yourself. Understood, Senior Chief. I will be ready at 0600. She turned to leave, but Vance's voice stopped her. For what it is worth, Corpsman Okonkwo, you are one of the finest medical personnel I have ever served with. Your technical skills are exceptional. Your dedication is unquestionable. But dedication without self-preservation is just slow suicide. I have seen too many good sailors destroy themselves, trying to be perfect. Maya looked back at him. I'm not trying to be perfect, Senior Chief. I'm trying to be sufficient. There's a difference. She left before he could respond. The flight to San Diego took 14 hours with 2 refueling stops. Maya spent most of it reviewing medical journals on her tablet and avoiding conversation with the other personnel rotating home. When they finally touched down at North Island Naval Air Station, the California sun felt aggressive after months in the desert. A driver took her directly to Naval Medical Center, San Diego. The sprawling facility felt surreal after the stripped-down efficiency of forward operating bases. Too clean, too quiet, too safe. The behavioral health building was in the East Wing. Maya reported to the reception desk and was directed to a waiting room decorated in calming blues and grays. Motivational posters about resilience and teamwork covered the walls. She found them condescending. Hospital Corpsman Second Class Okonkwo. Maya stood. The woman in the doorway wore the uniform of a Navy psychologist, a lieutenant commander with 15 years of service ribbons. Her expression was professionally neutral. I am Commander Patricia Reeves. Please come in. The office was smaller than Maya expected, dominated by a large desk and 2 chairs positioned for conversation rather than interrogation. Reeves gestured to one of the chairs and took the other, deliberately choosing the one without the desk between them. You know why you are here, Reeves said. It was not a question, but Maya answered anyway. Senior Chief Vance initiated a fitness for duty evaluation based on my injury rate and participation in the extended SEER program. That is the administrative reason. I am asking if you know the actual reason. Maya met her eyes. You think the program broke me. You think my pain tolerance indicates psychological damage rather than advanced training. Reeves smiled slightly. You are direct. I appreciate that. Let me be equally direct. The SEER extension program for medical personnel is controversial. Some people believe it creates more resilient combat medics. Others believe it creates medics who cannot recognize their own limitations. I am here to determine which category you fall into. I fall into the category of effective corpsman with a high patient save rate. Reeves pulled up a file on her tablet. You also fall into the category of corpsman with 7 combat injuries in 7 months. That is statistically significant, Petty Officer Okonkwo. It suggests either extremely bad luck or extremely poor judgment, or extremely high-risk situations where someone had to act. Why did that someone have to be you? Because I was there. Because I was capable. Because no one else would. Reeves made a note. Tell me about your sister. The question was so sudden, so precisely aimed at Maya's core wound, that she actually felt her pulse spike. The monitoring equipment she had not noticed in the corner beeped softly. My sister is not relevant to this evaluation. Your sister died when you were 18. She bled out from a stab wound while you tried to save her. You enlisted 2 weeks later. You volunteered for every high-risk training program the Navy offered. You have built your entire career around being the person who saves others. That seems extremely relevant. Maya's hands rested calmly in her lap, but her mind raced. Reeves had done her research. This was not going to be a simple box-checking evaluation. Elena died because help arrived too late, Maya said carefully. I became a corpsman to make sure that does not happen to others. That is not pathology. That is purpose. Purpose and obsession can look very similar, Reeves replied, especially when the person cannot tell the difference. Outside the window, palm trees swayed in the San Diego breeze. Maya thought about the desert, about the field hospital, about the patients who needed her and the evaluation that might keep her from them. What do you need from me, Commander? Maya asked. To determine I am fit for duty. Reeves leaned back in her chair. I need you to spend the next 2 weeks in intensive evaluation. Physical assessments, psychological screening, stress response testing. And I need you to be honest about what the SEER program really did to you. I can do that. Can you? Because from my preliminary review, honesty is not your strongest trait. You hide pain. You hide fear. You hide anything that might make you appear weak or in need of help. That is what the program taught you. The program taught me to survive. At what cost? Petty Officer Okonkwo. That is what we're going to find out. Maya left the appointment with a schedule for the next 14 days. Physical therapy, psychological sessions, biometric monitoring, sleep studies. They were going to examine every part of her to find the damage they were certain existed. She would pass every test. She would give them no ammunition. And then she would return to the work that mattered. Because if she stopped, if she allowed herself to be sidelined, then Elena had died for nothing. And Maya Okonkwo would not allow that. The evaluation began at 0500 with a physical assessment that felt more like an interrogation. Maya ran on a treadmill while technicians monitored her heart rate, oxygen levels, and pain responses. They gradually increased the incline and speed, watching for the moment when her body would force her to stop. That moment never came. After 40 minutes, the lead technician finally shut down the machine. Maya's vitals showed elevated heart rate and respiration, but nothing approaching distress. Her wounds had started bleeding through the dressings. She had not mentioned it. You are bleeding, the technician said, pointing at the growing red stain on her shirt. Maya looked down. Minor seepage. The stitches are holding. You should have stopped. You did not tell me to stop. The technician made notes on his tablet, his expression troubled. Most people would have felt the pain and stopped on their own. I felt the pain. I chose to continue. That is the problem, Petty Officer. Pain is your body telling you something is wrong. Ignoring it is maladaptive, or highly adaptive, depending on the context. The technician did not argue further. He simply added more notes to whatever report would eventually land on Commander Reeves' desk. The afternoon brought psychological screening. Maya sat in a small room answering questions on a computer. The assessment was designed to detect post-traumatic stress, depression, anxiety, dissociative disorders. Maya knew the markers they were looking for. She had studied psychology as part of her corpsman training. She answered honestly, but strategically. Yes, she thought about her sister. No, the thoughts did not interfere with her duties. Yes, she had witnessed traumatic events. No, she did not experience flashbacks or nightmares. The truth was that Maya had trained herself to compartmentalize so effectively that trauma lived in sealed boxes in her mind, opened only when useful. Day 3 brought the stress response testing. They placed her in a simulation chamber and created scenarios designed to trigger panic. Loud noises, flashing lights, simulated casualties screaming for help while she had to prioritize care under time pressure. Maya moved through each scenario with mechanical precision. Assess, prioritize, treat, move to next casualty. The screaming did not affect her. The chaos did not slow her. She had heard worse. She had seen worse. After the final scenario, Commander Reeves entered the observation room. You did not hesitate once, Reeves said. Hesitation kills patience. Even when the injuries were clearly unsurvivable, you still began treatment protocols. Until someone is confirmed dead, they are a patient. The protocols exist for a reason. Reeves studied her through the observation window. Most people show some emotional response to simulated suffering. Increased heart rate, facial tension. You showed nothing. I showed focus. You showed disconnection. There's a difference. Maya turned to face her directly. With respect, Commander, disconnection would mean I do not care. Ikare deeply. I simply do not allow emotion to interfere with treatment. That is discipline, not pathology. Reeves pulled up data on her tablet. Your heart rate during the most intense scenario was lower than your baseline. That is not discipline. That is your nervous system failing to recognize danger, or succeeding at remaining calm under pressure. The distinction matters, petty officer. One is a skill, the other is damage. By day 7, Maya had passed every physical test and answered every psychological questionnaire. Her wounds had healed enough to remove the stitches. She was stronger, faster, and more controlled than when she had arrived. But the evaluation was not going well. She could see it in how the staff looked at her, in the extra notes they made, in the private conversations that stopped when she entered rooms. They were building a case, and it was not the case she wanted them to build. On day 8, Commander Reeves called her in for an interim assessment. "We need to talk about your pain tolerance," Reeves said without preamble. "What about it?" "Yesterday, during the physical therapy session, the therapist applied pressure to your healing wounds to test tissue recovery. According to her notes, you showed no pain response, even when she pressed hard enough to reopen one of the incisions. The tissue integrity needed testing. That is not the point. The point is that you experienced significant pain and gave no indication. Not a wince. Not a change in breathing. Nothing. I was aware of the pain. I chose not to react. Why? Because reacting serves no purpose." Reeves leaned forward. "Pain serves a purpose, petty officer Okonkwo. It protects you from further injury. It signals when something is wrong. Your inability to respond appropriately to pain is not strength. It is a broken warning system. My warning system works fine. I know when I am injured. I simply do not let it control me. That is what concerns me. Pain should have some control. It should influence your decisions. The fact that it does not suggest the SEER program fundamentally altered your threat assessment capabilities." Maya felt the careful control she had maintained for 8 days start to crack. "The SEER program taught me to function when others cannot. It taught me to continue mission-critical tasks even under duress. That is exactly what combat corpsmen need." "At what cost?" Reeves repeated the question she had asked in their first meeting. "You have trained yourself to ignore your body's distress signals. You push through injuries that should sideline you. You take risks that endanger your own life, all in service of saving others. That is not healthy dedication. That is suicidal altruism. People are alive because of my choices, and you're damaged because of them." The words hung between them, sharp and final. "I want to show you something," Reeves said. She pulled up a medical file on her tablet. "This is your full injury history. 7 combat wounds in 7 months in Afghanistan. But before that, during your SEER training, you sustained 11 separate injuries. Broken ribs, dislocated shoulder, second-degree burns, severe lacerations. And according to the training records, you completed every phase despite those injuries. That was the point of the training. No, petty officer. The point of the training was to teach resistance to interrogation. You turn it into an endurance competition with yourself. The instructors noted that you pushed far beyond program requirements. They recommended psychological follow-up. That follow-up never happened because you deployed immediately after completion. Maya's hands were steady in her lap, but her pulse had spiked. The monitoring equipment beeped softly. I met the program standards. You exceeded them in ways that concerned the instructors. One of them wrote that you seemed to be punishing yourself rather than training. He specifically mentioned that your pain tolerance appeared to be rooted in self-destructive patterns rather than tactical necessity. That instructor does not know me. No, but I'm beginning to. And what I see is a young woman who watched her sister die and decided that if she could just be tough enough, strong enough, pain-resistant enough, she could prevent every future death. That is not possible, Maya. You cannot save everyone. and destroying yourself trying will not bring your sister back. The crack in Maya's control widened. She felt something rising that she had not allowed herself to feel in 9 years. Grief, raw and sharp and utterly unacceptable. "I need to return to duty," she said, her voice tight. "Not yet. We still have 6 days of evaluation. I have passed every test. You have passed every physical test. But this evaluation is not about your body. It is about your mind. And your mind is where the real damage lives." Maya stood abruptly. "Am I dismissed, Commander?" Reeves looked at her for a long moment. "You are dismissed. But Maya, running from this conversation will not make it less true." Maya left the office and walked across the base until she found an empty section of beach. The Pacific Ocean stretched gray and endless before her. She sat in the sand and for the first time in 9 years, allowed herself to cry. Not for Elena, not for the patients she had saved or the one she had lost. For herself, for the girl who had decided pain was weakness and weakness was death. She cried until the sun set and the cold wind off the ocean made her shiver. Then she stood, wiped her face, and walked back to base. 6 more days. She would give them 6 more days, and then she would prove them all wrong. The call came on day 9 at 0600. Maya was in the base gym running through her morning routine when her phone buzzed with a secured message. Commander Reeves wanted to see her immediately. Maya showered quickly and reported to the behavioral health building. Reeves was not alone. Senior Chief Derek Vance sat in one of the visitor chairs, his face unreadable. He had flown in from Afghanistan overnight. "Sit down, Petty Officer," Reeves said. Maya sat, her mind racing through possibilities. Nothing good came from having both your evaluator and your senior chief in the same room before an evaluation was complete. "We have a problem," Reeves began. "The preliminary assessment results indicate significant maladaptive pain responses and possible dissociative tendencies related to trauma. Normally, this would mean an extension of your evaluation period and likely reassignment to non-combat duties." Maya's stomach dropped, but she kept her face neutral. "However," Reeves continued, "Senior Chief Vance has presented additional information that complicates the situation." Vance leaned forward. "While you have been here, I have been reviewing the medical records from your deployments. Every save you made, every patient outcome. Your statistics are exceptional, Petty Officer. Your patient mortality rate is 0.4%. The Navy average for combat corpsmen is 3.0%. You have saved lives that any other corpsman would have lost. That should be good news, but the way Vance said it felt like an indictment. The problem," Vance continued, "is that many of those saves came at significant personal cost. You have sustained injuries while treating patients on 14 separate occasions. Twice you continued treatment while actively bleeding. Once you performed a blood transfusion using your own blood in the field because you were a universal donor and no supplies were available. I was the only viable option. You were the only option you allowed yourself to consider," Reeves interjected. "Every one of those situations had alternatives. Call for backup. Wait for secure transport. Prioritize casualties differently. But you consistently chose the option that put you at maximum risk, because those options produced the best patient outcomes." Vance shook his head. "Maya, I pulled the file on the convoy attack where you took shrapnel. Do you know what I found? The after-action report states that you ran into the kill zone to reach a wounded driver while the vehicle was still taking fire. 2 other corpsmen were present. Both stayed in cover and called for you to wait. You ignored them. The driver was bleeding out from a femoral artery wound. He had less than 3 minutes. And you nearly died getting to him," Vance said, his voice rising. "The shrapnel that hit you missed your kidney by 2 centimeters. If it had been 2 centimeters to the left, we would be having a very different conversation. Or no conversation at all. But it was not. And the driver lived." Reeves stood and walked to the window. "Petty Officer Okonkwo, I have been a Navy psychologist for 15 years. I have evaluated hundreds of personnel with various forms of trauma and behavioral issues. What you have is something I have only seen a handful of times. You have weaponized your trauma. You have turned your sister's death into a justification for self-destruction disguised as heroism. That is not what I am doing. Then explain to me why you volunteer for every dangerous assignment. Why you take risks no reasonable medical professional would take. Why you seem to have a pathological need to prove you can save everyone, even at the cost of your own life. Maya felt the words she had been holding back for 9 years rising in her throat. Because I watched my sister die in my arms and I could not stop it. Because the ambulance took 17 minutes and she only needed 5 more to live. Because I was useless and helpless and she died anyway. And if I'm not the person who runs into the kill zone, if I'm not the one who risks everything to save the patient, then what was the point of any of it? What was the point of her dying if I did not become someone who could prevent it from happening to anyone else? The silence that followed was absolute. Vance's expression had shifted from stern to something closer to grief. Reeves returned to her seat, her professional mask firmly in place. "That is what I thought," Reeves said softly. "Maya, your sister's death was a tragedy. But it was not your failure. You were 18 years old with minimal training. You did everything possible under those circumstances. It was not enough. It never would have been enough. That is what you need to understand. Even if you had been a fully trained paramedic, even if you had a complete field hospital in your apartment, she might have died anyway. Trauma care is not about perfect outcomes. It is about doing the best you can with what you have. You already knew that, but you cannot accept it because accepting it means accepting that Elena's death was not preventable. And if it was not preventable, then all your suffering since has been for nothing." Maya felt tears threatening again. She forced them back. "I am recommending you be removed from combat duty," Reeves said. "Not because you are not capable, but because you are too capable. You will keep pushing until one of those 2-centimeter margins goes the wrong way. And the Navy will lose an exceptional corpsman because she could not save herself." The words hit like a physical blow. Removed from combat duty meant desk work, training assignments, everything she'd spent 9 years building gone. "You cannot do that," Maya said, her voice cracking. "I can and I will, unless you can convince me otherwise." "How? What do you want from me?" "I want you to acknowledge that your current behavior is unsustainable. I want you to commit to therapy that addresses the root trauma. And I want you to accept limitations on your deployment parameters. You want me to be less effective. I want you to survive long enough to have a career instead of a funeral." Vance spoke for the first time in several minutes. "There is another option." Both women turned to look at him. "The SEAL teams are looking for corpsmen," Vance said. "Not for deployment. 4 training positions at Camp Pendleton, teaching tactical medicine to new SEAL candidates. It would keep you in the field medicine space, but remove you from active combat zones." "That is a desk job with a different title," Maya said. "No, bon city place. It is a chance to save lives by creating more corpsmen like you. Better corpsmen than you, because they will learn from your skills without adopting your self-destructive patterns." Maya looked between them. This was the offer. The compromise. Take the training position or face medical discharge. "The driver you saved in the convoy attack," Vance said quietly. "His name is Corporal Davies. He has 3 children. Because you ran into that kill zone, those children still have a father. That matters, Maya. But it would matter even more if you taught 100 corpsmen how to make those saves without dying in the process." "I need time to think," Maya said. "You have until tomorrow morning," Reeves replied. 900 hours. Make your decision." Maya left the building and walked until she found herself at the base chapel. She had not been religious since Elena died, but the quiet space felt appropriate for the decision ahead. She could fight them, demand to return to combat duty, probably lose and face discharge. Or she could accept the training position, teach others, save lives indirectly. Or she could finally admit what she had been running from for 9 years. That Elena was gone. That no amount of saves would bring her back. That destroying herself would not honor her sister's memory. It would just create another tragedy. Maya sat in the empty chapel as afternoon light filtered through stained glass windows. She thought about the driver with 3 children, about the young Marine she had given her morphine to, about every patient she had saved and every scar she had earned. She thought about Elena, 16 and dying, asking if she would be okay. Maya had spent 9 years trying to answer that question. Maybe it was time to ask it of herself instead. When she left the chapel 3 hours later, she knew what her answer would be. She just was not sure yet if she had the courage to say it. Maya arrived at Commander Reeves's office at 0845, 15 minutes early. Senior Chief Vance was already there, along with someone Maya had not expected to see. A Navy captain with SEAL Trident insignia and enough ribbons to indicate 3 decades of service. Captain Morrison, Reeves said by way of introduction. He commands the SEAL training program at Camp Pendleton. I asked him to be present for your decision. Morrison stood and extended his hand. Maya shook it, noting the strength in his grip and the assessment in his eyes. This was a man who had spent his career evaluating people under pressure. Petty Officer Okonkwo, Morrison said, I have read your file. Impressive statistics. Also concerning injury patterns. Maya remained standing at attention until Reeves gestured for her to sit. Before you tell us your decision, Morrison continued, I want you to understand what the training position actually entails. You would be assigned to basic underwater demolition/SEAL training. Bud/S. You would work specifically with the medical curriculum teaching SEAL candidates advanced tactical medicine. It is not a desk job. It is one of the most demanding instructor positions in the Navy. How so? Maya asked. Because SEAL candidates will test you, Morrison said. They will push you to see if you break. They will question whether a corpsman who has never been through BUD/S has any business teaching them. And they will absolutely notice any weakness. If you take this position expecting it to be easier than combat deployment, you will be mistaken. I'm not looking for easier, Maya said. I am looking for useful. Reeves leaned forward. Have you made your decision? Maya took a breath. She had spent all night weighing the options, running through scenarios, trying to find an angle that let her return to Afghanistan. There was not one. At least, not one that did not end with her discharged or dead. I will accept the training position at Camp Pendleton, Maya said. On 2 conditions. Morrison raised an eyebrow. You're negotiating. I am clarifying expectations. First condition, I want regular recertification opportunities. If I am teaching tactical medicine, I need to maintain my own skills at deployment level. Reasonable, Morrison said. Approved. Second condition. I want the option to deploy again. Not immediately, but if I complete therapy, if I pass future evaluations, I want combat duty to remain possible. I will not accept a permanent desk assignment. Reeves and Morrison exchanged glances. That is acceptable, Reeves said. Assuming you make genuine progress in therapy and demonstrate sustainable behavioral patterns. This is not a permanent ban, Maya. It is a necessary pause. Maya felt something release in her chest. Not relief exactly. More like the first breath after holding it too long. There's one more thing, Vance said. He had been quiet until now, watching the exchange. I am also being reassigned to Camp Pendleton as senior medical instructor. Maya looked at him sharply. You're leaving Afghanistan. My rotation was already ending. I requested the Pendleton assignment 3 days ago. Someone needs to make sure you do not turn the SEAL candidates into reckless martyrs. Despite everything, Maya almost smiled. You think I would teach them my bad habits? I think you will teach them to be exceptional. My job is to teach them to survive being exceptional. Morrison stood, signaling the meeting was ending. You start in 2 weeks. Use that time to finish your evaluation and begin therapy. When you arrive at Pendleton, I expect you ready to work. The next BUD/S class starts in 3 weeks. You will be fully integrated by then. Understood, sir. After Morrison and Vance left, Maya remained seated across from Reeves. You made the right choice, Reeves said. I made the only choice that keeps me in medicine. That too. But Maya, I meant what I said about therapy. This is not a formality. You have genuine trauma that manifests in dangerous ways. If you do not address it, you will eventually hurt yourself or someone else. I will attend therapy. Attending and participating are different things. I know. Reeves pulled up a file on her tablet. I am assigning you to Dr. Sarachan. She specializes in trauma related to loss and survivor guilt. She is also a veteran. Marine Corps. She understands the military culture and will not accept deflection. When do I start? Tomorrow. 0900. And Maya, she will push you harder than I have. If you're not ready to be honest about Elena, about the SEER program, about why you do what you do, then this will not work. I am ready. We will see. That evening, Maya called James Park. He was still in Afghanistan, still dealing with the understaffed medical unit she had left behind. You are staying stateside, Park said when she told him. Training assignment. For now, with option to redeploy if I fix my apparent psychological damage. Is it damage, Park asked, or is it just who you are? Apparently, there is a difference. Apparently, I have weaponized my trauma. Park was quiet for a moment. You know my sister died in Fallujah. You mentioned that. What I did not mention is that after she died, I volunteered for every dangerous assignment I could find. Anbar Province. Helmand. Places where the casualty rates were highest. I told myself it was about honoring her sacrifice. Really, I was trying to join her. Maya had not known that. It took me 3 years and a mandatory psych eval to figure out I was suicidal, Park continued. Not in the sense of wanting to actively kill myself, but in the sense of not caring if I lived or died. When you do not care about your own survival, you make dangerous decisions and call them brave. That sounds familiar. The difference between us is I got help before I got killed. You're getting help now. That is not failure, Maya. That is smart. After they hung up, Maya sat in her temporary quarters and pulled out a photo she had not looked at in years. Elena at 15, laughing at something outside the frame. Young and alive, and completely unaware she had less than a year left. Maya had spent 9 years trying to save Elena by saving everyone else. Maybe it was time to admit that Elena was beyond saving. And maybe, just maybe, it was time to save herself instead. The next morning, Maya reported to Dr. Sarachen's office. Chun was 45, compact and direct, with the bearing of someone who had seen combat and refused to be impressed by anything less. Tell me about your sister, Chun said without preamble. For the first time in 9 years, Maya did not deflect, did not minimize, did not hide behind professional detachment. She told Chun everything. About Elena bleeding out on the apartment floor. About the 17 minutes. About the paramedics saying 5 minutes would have made the difference. About enlisting to become the person who arrived in time. About the SEER program and learning to ignore pain. About every injury and every save and every moment she had chosen patience over herself. Chun listened without interrupting. When Maya finally finished, Chun leaned back in her chair. You have been punishing yourself for 9 years for failing to save someone you had no realistic chance of saving, Chun said. That is textbook survivor guilt combined with magical thinking. You believe if you just suffer enough, if you just save enough people, it will retroactively make your sister's death meaningful. It has to mean something. It means a young woman died tragically. That is all. Not because you failed. Not because the universe needed balance. Just because sometimes terrible things happen and there is no deeper meaning. The meaning you create comes from how you live after the loss, not from destroying yourself in her name. I do not know how to do that. Then we will figure out together, Chun said. But Maya, you need to understand something. Therapy is not about making you stop caring. It is about teaching you to care in sustainable ways. You can still be an exceptional corpsman. You can still save lives. You just have to stop dying in the process. Maya looked at the woman across from her and saw something she had not seen in the other evaluators. Not pity, not judgment, understanding. I'm willing to try, Maya said. Good, Chun replied, because the Navy is investing a lot in you. And more importantly, you are worth the investment, even if you do not believe that yet. Over the next 2 weeks, Maya attended therapy 3 times a week. Chun pushed her exactly as promised, refusing to accept deflection or professional detachment. They talked about Elena, about the moment she died, about the guilt and the anger and the grief Maya had been running from for 9 years. It was excruciating. It was also necessary. On her last day before reporting to Camp Pendleton, Maya visited Elena's grave for the first time since the funeral. She brought flowers and sat in the grass beside the headstone. I am sorry I could not save you, Maya said quietly. I am sorry I spent 9 years trying to save you by destroying myself. I'm going to do better now. I'm going to live in a way that honors you without killing me. I think you would want that. The wind rustled through the cemetery trees. Maya sat until the sun began to set. Then she stood, touched the headstone one last time, and walked back to her car. Tomorrow she would report to Camp Pendleton. Tomorrow she would begin teaching others to save lives. But tonight, for the first time in 9 years, Maya Okonkwo chose to save herself. Camp Pendleton sprawled across 125,000 acres of Southern California coastline. Maya reported to the Special Warfare Training Center at 0600 on a Monday morning, her orders crisp in her hand and her mind clearer than it had been in years. The medical training facility was a complex of buildings near the beach where BUD/S candidates spent 6 months being broken down and rebuilt into SEALs. Senior Chief Vance met her at the entrance, looking more rested than he had in Afghanistan, but no less intense. "Welcome to the hardest teaching job in the Navy," Vance said. "Your students will be the most motivated and most arrogant individuals you have ever encountered. They chose to be here. They believe they are exceptional. Your job is to prove they are not exceptional enough yet." Maya followed him through the facility. The medical training wing had state-of-the-art simulation equipment, fully stocked supply rooms, and classroom space designed for hands-on learning. It was a far cry from the stripped-down efficiency of forward operating bases. "You will teach tactical medicine 3 days a week," Vance explained. "Combat casualty care, field triage, trauma management under fire. The curriculum is standardized, but Captain Morrison wants you to incorporate real-world scenarios from your deployments, drawing from experience. Your experience specifically. The candidates need to understand what actual combat medicine looks like, not the sanitized version from textbooks." They reached a classroom where 20 SEAL candidates sat waiting. All male, all physically imposing, all watching Maya with varying degrees of skepticism as she entered. "Gentlemen," Vance said, his voice carrying parade ground authority. "This is Hospital Corpsman Second Class, Okonkwo. She'll be your tactical medicine instructor for the next 12 weeks. I suggest you pay attention. She has more combat experience than most of you will accumulate in your entire careers." Vance left. Maya stood at the front of the room, acutely aware of being 5'6" and female in a space designed for men who average 6 feet and 200 pounds of muscle. The candidates stared at her with expressions ranging from curious to dismissive. "Good morning," Maya said. "I am going to be direct, because you will appreciate that more than politeness. Some of you are looking at me and thinking I cannot teach you anything useful because I have never been through BUD/S. You are correct. I have not. I have, however, kept Navy SEALs alive under conditions that would make your training exercises look like summer camp. So here's how this works. You listen, you learn, you apply what I teach. And when you graduate and deploy, you do not die from preventable injuries because you thought you knew better than your corpsman." A candidate in the front row raised his hand. Tall, broad-shouldered, with the confidence of someone who had never failed at anything. "Yes," Maya said. "With respect, ma'am," the candidate said, "how do we know you can handle the physical demands of teaching us? BUD/S medical training includes water operations, combat scenarios under load, and 12-hour field exercises. No offense, but you do not look like you can keep up." Maya had expected this. Morrison had warned her it would come. "What is your name, candidate?" "Petty Officer Jackson, ma'am." "Petty Officer Jackson, I have performed emergency surgery in the back of a moving vehicle while taking small arms fire. I have carried wounded Marines twice my size 3 kilometers through hostile territory. I have worked 7 Titwohor shifts in a field hospital with no sleep and minimal supplies. If you're concerned about whether I can keep up with you, I suggest you focus on whether you can keep up with me." Jackson smiled slightly, apparently satisfied with the response. The first week was a test. The candidates pushed boundaries, questioned techniques, and watched for any sign of weakness. Maya met every challenge with calm competence. When they questioned a procedure, she explained the medical reasoning. When they doubted her physical capability, she demonstrated it. When they implied she did not understand their world, she shared stories from Afghanistan that made several of them go quiet. By week 2, The dynamic had shifted. The candidates stopped testing and started learning. Maya taught them how to perform cricothyrotomy on a simulated trachea, how to pack a sucking chest wound, how to establish N4 while wearing gloves and body armor, how to make life-or-death triage decisions in 30 seconds. She also taught them something not in the curriculum: how to recognize when a corpsman was reaching their breaking point, how to support medical personnel who were pushing too hard, how to identify the difference between dedication and self-destruction. After one particularly intense session on managing multiple casualties simultaneously, a candidate named Ramirez approached her. "Ma'am, can I ask you something personal?" he said. "You can ask. I may not answer. The rumor is you were in some kind of advanced pain tolerance program, that you can work through injuries that would stop most people. Is that true?" Maya considered how much to reveal. She had promised Dr. Chun she would be more honest about her experiences, but she also knew the power of mystique in earning respect. "I participated in an extension of the SEER program," Maya said carefully. "It taught me to function under extreme duress. But, Petty Officer Ramirez, I need you to understand something. Pain tolerance is not the same as invincibility. I have scars from every time I pushed too far. The program taught me how to endure, but experience taught me the cost of endurance. Do not confuse the two." "Is that why you are here instead of deployed?" Ramirez asked, then immediately looked like he regretted the question. "Yes," Maya said simply. "I pushed until the Navy made me stop. Learn from that. Be tough enough to do the job, but smart enough to know your limits. The best corpsmen are not the ones who die heroically. They're the ones who live to save the next patient." On week 3, Captain Morrison observed one of her classes. Maya ran the candidates through a scenario based on the convoy attack, where she had been wounded. Multiple casualties, limited supplies, active hostile fire, time pressure. She did not tell them it was her own experience. She just watched how they handled it. Most of them made reasonable decisions. A few made excellent ones. Jackson, the candidate who had questioned her in week 1, successfully managed 4 casualties and evacuated them in proper priority order. After the exercise, Morrison pulled her aside. "You're holding back," he said. "Sir, you're teaching them well, but you're not teaching them everything you know. I can tell. Where are you protecting them from?" Maya watched the candidates cleaning equipment and debriefing each other. "I am protecting them from thinking that breaking yourself is heroic. I can teach them the skills without teaching them my mistakes." Morrison nodded slowly. "Good. That is the difference between an instructor and a cautionary tale. Keep that boundary." That evening, Maya had her weekly therapy session with Dr. Chun via video call. Chun was monitoring her progress remotely, checking for signs that the training environment was triggering old patterns. "How are you managing the urge to prove yourself?" Chun asked. "Better than expected. I realized something this week. Teaching is its own kind of saving lives. Every technique I give these candidates might save someone years from now. That satisfies the same drive without requiring me to bleed for it. That is significant progress," Chun said. "Are you still having the dreams about your sister?" "Less frequently. When I do, they're different. Less about the moment she died and more about memories of when she was alive. I think that is healthier." "It is. You are processing the loss instead of just reliving the trauma. That is what healing looks like." After the session, Maya walked down to the beach. The Pacific Ocean was calm, reflecting the sunset in shades of orange and purple. She thought about Elena, about the 9 years spent running from grief, about the chance she had now to live differently. A figure approached along the shoreline. Senior Chief Vance, walking his evening rounds with his characteristic limp. "How are the candidates treating you?" he asked when he reached her. "With respect now. Week 1 was rough, but we found our rhythm. They are lucky to have you, even if they do not fully understand why yet." Maya smiled. "You were right, you know. Back in Afghanistan, I was damaged, just not in the way you thought. None of us leave combat undamaged," Vance said. "The question is whether we heal or let the damage define us. You're choosing to heal. That takes more courage than running into kill zones." They stood together watching the waves. Maya thought about the choice she had made, about therapy and training and the long road ahead. "Senior Chief," Maya said, Why did you really request the Pendleton assignment? You could have stayed in theater. You are one of the most experienced combat corpsmen in the Navy. Vance was quiet for a moment. Because I saw myself in you. 20 years ago, I was the corpsman who took every risk, who pushed through every injury, who thought pain was weakness. It nearly killed me. When I saw you doing the same thing, I knew someone had to stop you before you went too far. And I knew that someone had to understand what drives it. You lost someone too. My daughter. Not in combat. Medical malpractice during a routine surgery. She was 16. I became a corpsman 6 months later. Spent 15 years trying to save enough lives to balance the one I could not save. Maya looked at him with new understanding. Does it ever balance? No, Vance said. But eventually you stop trying to balance it and start just living. That is what I want for you. To live without the debt you think you owe. The sun dipped below the horizon, leaving them in twilight. Tomorrow, Maya would teach another class. Would share her knowledge without sharing her scars. Would save lives by creating better corpsmen instead of destroying herself one patient at a time. It was not the path she had imagined 9 years ago, but it was the path that would let her survive. And survival, Maya was finally learning, was its own form of heroism. The call came during week 6 of the training cycle. Maya was in the middle of teaching wound packing techniques when Captain Morrison appeared in the classroom doorway. His expression was grim. Petty Officer Okonkwo, a word please. Maya handed the demonstration to Senior Chief Vance and followed Morrison into the hallway. We have a situation, Morrison said without preamble. SEAL Team 7 just took heavy casualties during an operation in Yemen. 3 Kia, 5 wounded. They're being medevaced to Germany, but 2 of the wounded are critical. The team's senior corpsman was one of the Kia. Maya felt her pulse quicken, but kept her voice steady. I'm sorry to hear that, sir. How can I help? The team is requesting you specifically. Apparently one of the wounded is Corporal Davies, the driver you saved in Afghanistan. He is asking for you. The name hit Maya like a physical blow. Davies. 3 children. The man she had run into a kill zone to save. The reason Vance had used to convince her to accept the training position. What is his condition? Maya asked. Severe abdominal trauma. He is stable enough to fly, but he will need surgery within 24 hours. The problem is that Team 7 is refusing to let German surgeons operate. They want their own medical team. They are requesting you be temporarily assigned to Landstuhl Regional Medical Center to oversee his care. Morrison, that is not protocol. I am not deployed. I am in a training assignment specifically because I was deemed unsuitable for combat medicine. I know, but Davies is refusing surgery from anyone he does not know. He is convinced that anyone except you will let him die. His team commander is backing him up. They are making it a formal request through channels. Maya's mind raced. This was exactly the kind of situation Dr. Chun had warned her about. The pull back into high-stakes medicine. The temptation to prove she was still capable. The risk of falling into old patterns. Sir, I need to consult with my therapist before making this decision. Morrison nodded. You have 2 hours. Davies is currently stable, but deteriorating. After that, the decision will be made for you. Maya found a quiet office and called Dr. Chun on a secured line. Maya, Chun said after hearing the situation, what do you want to do? I want to go. Davies is alive because of me. If he dies because I refuse to help, I will never forgive myself. That is your trauma talking, not your medical judgment. You're not responsible for every outcome of every patient you have ever treated. Davies has access to excellent surgeons in Germany, but he is asking for me specifically because trauma creates bonds, because he associates you with survival. But Maya, you need to ask yourself honestly, are you the best person for this case? Or are you the person he remembers from the worst day of his life? Maya was quiet. I need you to walk through this rationally, Chun continued. If you go, you will be working in a high-stress surgical environment with a patient who has emotional attachment to you. That creates pressure beyond normal medical care. Can you handle that pressure without reverting to your old patterns? I've been doing therapy for 6 weeks, which is excellent progress. But 6 weeks does not undo 9 years of behavioral conditioning. If you take this assignment and it triggers a relapse, you could undo all the work we have done. Worse, you could make a medical error because you're too emotionally invested. So I should refuse. Let someone else treat him. I'm not telling you what to do. I am asking you to make the decision from a place of genuine self-awareness rather than guilt and obligation. Maya thought about Davies, about his children, about the moment she had pulled shrapnel from his leg while bullets cracked overhead, about the thank you he had whispered before losing consciousness. She also thought about the last 6 weeks, about teaching candidates, about therapy sessions, about visiting Elena's grave and choosing to live differently. What if I go but with support? Maya said. Senior Chief Vance could accompany me. He could monitor my behavior, pull me back if I start pushing too hard, and I could commit to limiting my role. I will consult on Davies' case, but I will not be the primary surgeon. I will support the surgical team, not replace them. Chin was quiet for a long moment. That is a very mature approach. You are setting boundaries and acknowledging your limitations. That is exactly the kind of thinking I want to see from you. So you think I should go? I think if you can maintain those boundaries, this could actually be therapeutic, proving to yourself that you can help without sacrificing yourself. But Maya, the moment you feel yourself slipping into old patterns, you need to step back. Promise me. I promise. Morrison approved the temporary assignment with conditions. Vance would accompany her. Her role would be strictly consultative. She would return to Pendleton within 72 hours regardless of Davies' condition. And she would check in with Chin daily. They flew out that evening on a military transport. Vance sat across from Maya in the cargo bay, watching her with the careful attention of someone monitoring a recovering addict near temptation. How are you feeling? He asked. Nervous. This is the first real test since I started therapy. The fact that you recognize it as a test is a good sign. 6 months ago, you would have seen it as an opportunity to prove yourself. Now you see it as a risk to manage. I'm trying to do better. Trying is all anyone can ask. They landed at Ramstein Air Base in Germany and transferred immediately to Landstuhl Regional Medical Center. The massive facility served as the primary treatment center for wounded American service members in Europe. Davies was in the surgical wing, stable, but waiting. Maya entered his room with Vance behind her. Davies was awake, his face drawn with pain despite the medication. When he saw her, his expression shifted to something like relief. Doc Okonkwo, he said, his voice weak. It told me you were stateside. I did not think you would come. Maya approached his bedside and checked his chart. His vitals were acceptable, but his white blood cell count was rising. Infection setting in. The surgery could not wait much longer. I am here as a consultant, Corporal Davies. The surgical team here is excellent. They're going to take good care of you. I want you in the operating room. You saved me once. I trust you to do it again. Maya felt the pull, the need to say yes, to be the hero, to prove she was still capable. She took a breath and pushed it down. Davies, I'm going to be honest with you. I'm a good corpsman, but the surgeons here have more experience with abdominal trauma than I do. They have better equipment, better support staff, and they are not emotionally invested in your case. That makes them better suited for this surgery. But what if something goes wrong? Then they will handle it. Davies, you survived because I did my job in the field. Now you need to let these surgeons do their job in the operating room. I will be there consulting, but I am not going to pretend I'm more qualified than I am. That would be ego, not medicine. Davies looked at her for a long moment, then nodded slowly. Okay, document. If you trust them, I trust them. The surgery took 6 hours. Maya stood in the observation gallery with Vance, watching the German surgical team work with precision and skill. They removed damaged tissue, repaired the torn intestine, and cleaned the infection. It was textbook perfect. Maya's role was minimal. She provided context about Davies' initial field treatment. She answered questions about his medical history. But she did not scrub in, did not take over, did not insert herself into a process that was working fine without her. When it was over, the head surgeon found her in the gallery. Your patient will make a full recovery, he said in accented English. The field treatment you provided saved his life. The delay in surgery could have been fatal without such skilled initial care. Thank you, Maya said. Your team did excellent work. You did not want to be in the operating room, he observed. I wanted to be. But wanting and needing are different things. You had it under control. The surgeon smiled. That is wisdom. Many field medics cannot let go of their patients. They think they are the only ones who can save them. You have learned better. After Davies woke from anesthesia, Maya visited his room one final time. The surgery went perfectly, she told him. You're going to be fine. Full recovery expected. Thank you for coming, Davies said. I know it probably messed up your schedule. It did not mess up anything, Maya replied. But Davies, I need you to understand something. I was glad to consult on your case. But the surgeons here are the ones who saved you today. Not me. Give credit where it is due. I will. But Doc, can I ask you something? Of course. Why did you run into that kill zone for me? You did not know me. You had other patients. Why risk your life for a stranger? Maya thought about how to answer. About Elena. About 9 years of trying to save everyone. About the therapy and the realization that had come from it. Because at the time, I thought saving you would save me too. I was wrong about that. But I am glad you were alive anyway. Davies smiled tiredly. Whatever the reason, I am grateful. My kids are grateful. That has to count for something. It does, Maya said. It absolutely does. She and Vance flew back to California the next morning. During the flight, Vance handed her a thermos of coffee. You did well, he said. You set boundaries. You supported without taking over. You let the experts do their jobs. That is growth. It felt like giving up. No, it felt like humility. There's a difference. You're learning it. Maya sipped the coffee and looked out the window at the Atlantic Ocean far below. She had come to Germany expecting to prove she was still the corpsman who ran into kill zones. Instead, she had proven she was becoming someone better, someone who saved lives without destroying her own. When they landed at Camp Pendleton, Captain Morrison met them on the tarmac. Davies is stable, Maya reported. Full recovery expected. The German surgical team was excellent. I heard. I also heard you declined to scrub in despite the patient requesting it. That took discipline. It took therapy, sir. Morrison smiled. Same thing in this case. Welcome back, petty officer. Your candidates missed you. The final exercise began at 0400 on a moonless Thursday morning. 12 weeks of training had led to this moment. The SEAL candidates would face a 7-Titwohor field operation that tested everything they had learned, including tactical medicine under the most realistic combat conditions the Navy could simulate. Maya stood in the operations center watching monitors display the candidates' locations across the training area. 20 candidates had started the course. 18 remained. The final 2 had been dropped for medical issues unrelated to training. The 18 who remained were exhausted, pushed to their absolute limits, and about to face their hardest test yet. Senior Chief Vance joined her at the monitors. They have no idea what is coming. They're about to find out, Maya replied. The scenario was designed to break them. Multiple casualty events, equipment failures, hostile fire simulations using pyrotechnics and blank rounds, communication blackouts, and embedded within the chaos, real medical emergencies that would require everything Maya had taught them. Captain Morrison entered the operations center and walked to the command console. Execute Phase 1. On the monitors, Maya watched as the first explosion rocked the candidate's position. Smoke filled the air. Simulated enemy fire erupted from multiple directions. And in the middle of it all, the first casualty went down. The casualty was not simulated. It was a training instructor in full combat gear, wearing realistic wound prosthetics that bled theatrical blood. The candidates had 30 seconds to recognize the threat, establish security, and begin medical treatment. Any longer, and the casualty would be declared Kia. Jackson was first to respond. He directed 2 candidates to return fire while he dropped beside the casualty and began assessment. Airway clear. Breathing labored. Circulation compromise. Massive bleeding from femoral artery. Maya watched him work. His hands were steady despite the chaos. He applied a tourniquet high and tight, checked for additional wounds, and called for evacuation. Textbook perfect. 60 seconds. Casualty stabilized. Good start, Vance murmured. The exercise escalated over the next 6 hours. More casualties, equipment malfunctions, a simulated chemical exposure that required decontamination procedures, a training boat that took water and forced candidates to perform CPR while bailing. Through it all, Maya watched her students apply everything she had taught them. They made mistakes. They hesitated. They improvised. But they kept their casualties alive. At hour 12, the scenario shifted. A candidate named Ramirez was running a security patrol when he collapsed. Not part of the simulation. Real medical emergency. Maya was moving before the monitors even registered what happened. She grabbed a medical kit and sprinted toward Ramirez's location half a kilometer away. Vance was right behind her, calling for the safety team. When Maya reached Ramirez, 2 other candidates were already working on him. His skin was pale and clammy. His breathing was rapid and shallow. His pulse was weak and thready. What happened? Maya demanded. He just went down, one candidate said. No trauma. No apparent cause. Maya performed a rapid assessment. No obvious injuries. Pupils equal and reactive. But something was very wrong. She checked his medical history in her head. Ramirez had mentioned during week 2 that he had a heart condition as a child. Surgically corrected. Cleared for service. But cleared did not mean immune to stress. We need a medevac now, Maya said. Possible cardiac event. The safety team arrived with a stretcher and advanced monitoring equipment. Maya stepped back and let them work, fighting every instinct that screamed at her to take over. These are trained paramedics. They had this. Ramirez was airlifted to the base hospital within 15 minutes. Maya rode with him, monitoring his vitals while the paramedics worked. In the controlled environment of the helicopter, they stabilized him quickly. By the time they landed, his color was improving and his vitals were normalizing. At the hospital, the emergency room physician confirmed Maya's assessment. Stress-induced arrhythmia. Ramirez's repaired heart valve had struggled under the extreme physical demands of the exercise. He would be fine with rest and medication adjustment, but his SEAL training was over. Maya sat with Ramirez after the medical team cleared out. He stared at the ceiling, tears running silently down his face. 12 weeks, he said quietly. I made it through 12 weeks just to have my heart quit on me. Your heart did not quit. It just reminded you that you are human. That happens to everyone eventually. Not to you. You went through worse, and you are fine. Maya pulled a chair close to his bed. Ramirez, I need to tell you something. I'm not fine. I spent 9 years pushing my body past its limits and ignoring every warning sign. I did permanent damage to myself. My pain tolerance is not a feature. It is scar tissue from repeatedly breaking myself. Do not aspire to that. But you saved all those lives, and I nearly destroyed mine doing it. You want to know the real reason I am teaching instead of deployed? Because the Navy pulled me from combat duty before I killed myself trying to be invincible. You are getting that warning now, at the beginning of your career. That is a gift. It does not feel like a gift. I know. But Ramirez, you made it through 12 weeks of the hardest training in the military. That proves you are exceptional. What happens next is you find a different way to serve. One that does not require you to destroy yourself. After leaving Ramirez, Maya returned to the operations center. The exercise was entering its final phase. The remaining 17 candidates were exhausted but functional. They had handled 8 major casualty events, 3 equipment failures, and countless smaller challenges. Now came the final test. Morrison looked at Maya. Are you ready to run the culminating scenario? Maya took a breath. The culminating scenario was her design. A recreation of the convoy attack in Afghanistan. The one where she had taken shrapnel. The one where she had given away her morphine. The one that had started the chain of events that led her here. I am ready, sir. Morrison activated the scenario. On the monitors, the candidate's convoy came under simulated attack. Multiple casualties simultaneously. Limited supplies. Active hostile fire. Exactly the situation Maya had faced. The candidates scattered to their assigned positions. Jackson took charge of medical triage. Other candidates established security and began treatment. Maya watched them work, seeing her own techniques reflected in their actions. but they made one critical difference. When Jackson realized he was low on morphine, he did not give his dose to another casualty. He properly rationed the supplies across all patients according to medical need. He managed resources instead of martyring himself. Maya felt something release in her chest. They had learned not just the techniques, but the philosophy behind them. They would save lives without destroying themselves in the process. The scenario ended after 18 hours. The candidates had kept every casualty alive. They had made smart decisions under pressure. They had worked as a team. They had passed. Morrison called them into formation outside the operations center. They stood exhausted and filthy but proud. "Gentlemen," Morrison said, "you have completed the tactical medicine portion of BUD/S. Your instructor, Hospital Corpsman Second Class Okonkwo, has prepared you for the reality of combat medicine. Some of you will deploy with SEAL teams. Some will face actual casualties. When that day comes, remember what you learned here. Save lives, support your team, and survive to save the next patient." The candidates turned as one to face Maya and came to attention. "Huya, Doc," Jackson called out. The others echoed him. "Huya." Document Maya felt tears threatening, but kept her composure. "Huya, gentlemen, go get some sleep." After they dispersed, Vance found her still standing in the operations center, watching the empty monitors. "You did good work here," he said. "Those candidates are better prepared than any class I have seen. One of them almost died, but he did not. And you handled it perfectly. You assessed, you called for help, you stepped back and let the experts work. That is exactly what you needed to do." Maya nodded slowly. "Ramirez will recover, but his SEAL career is over. That feels like failure. That is him learning his limits before they killed him. That is success, not failure. He will find another way to serve, just like you did." Captain Morrison approached with a folder. "Petty Officer Okonkwo, I have your next orders." Maya took the folder and opened it. Inside was a recommendation for advancement to Hospital Corpsman First Class, a commendation for excellence in instruction, and a note from Morrison. The note was brief. "You have proven yourself as an instructor. You have also proven you can maintain healthy boundaries while working in high-stress medical situations. If you want to return to deployment, I will support that recommendation. But I hope you will consider staying here. We need instructors who understand both the medicine and the cost of doing it wrong." Maya looked at the note for a long time. 6 months ago, she would have jumped at the chance to deploy again, to prove herself, to return to the work that defined her. Now, she was not sure that work defined her anymore. "Sir," Maya said to Morrison, "I need some time to think about this." "Take all the time you need," Morrison replied. "You have earned it." That evening, Maya walked down to the beach and called Dr. Chen. "I think I want to stay," Maya said after explaining the choice. "I think teaching might be where I belong now." "Why the uncertainty?" Chen asked. "Because part of me still believes that if I am not saving lives directly, I am not honoring Elena. That staying here is taking the easy path." "And what does the healthier part of you believe?" "That I can honor Elena by creating better corpsmen than I was. By teaching them to save lives without sacrificing themselves. By doing the work I wish someone had done for me 9 years ago." "Then you know your answer," Chen said. "Trust the healthier voice." Maya ended the call and sat watching the sunset paint the ocean in shades of gold and crimson. Tomorrow she would give Morrison her decision. But tonight she allowed herself to simply be. Not a hero, not a martyr. Just Maya Okonkwo, doing her best to live well instead of dying nobly. It was enough. Maya gave Captain Morrison her answer 3 days later in his office overlooking the Pacific Ocean. The decision had taken less time than she expected. Once she stopped fighting what she already knew, the choice became obvious. "I want to stay at Camp Pendleton," she said. "I want to continue as a tactical medicine instructor." Morrison leaned back in his chair, a slight smile on his weathered face. "That is the right choice. Not just for you, for the program. You have something most instructors lack. You have lived the consequences of both excellence and excess. That perspective is invaluable." "Thank you, sir. There is one condition," Morrison continued. He slid a folder across his desk. "I want you to develop an advanced curriculum. Something beyond the standard BUD/S medical training. a program that teaches corpsmen assigned to SEAL teams how to maintain peak performance without burning out, how to recognize their limits, how to survive a full career instead of flaming out after 2 deployments. Maya opened the folder. Inside were statistics on corpsman attrition rates, medical discharge data, and psychological evaluation patterns. The numbers were sobering. Nearly 40% of SEAL Team corpsmen left service within 5 years due to injury or psychological issues. This is about preventing what happened to me, Maya said, and what happened to dozens of others. You are proof that the current system breaks even the best people. Help me fix it. Over the next month, Maya designed a curriculum. She consulted with Dr. Chun on psychological resilience. She interviewed veteran corpsmen about their experiences. She studied programs from other special operations units. And she built something comprehensive, the Advanced Tactical Medicine Sustainment Course. 4 weeks of intensive training focused not just on medical skills, but on self-preservation, stress management, and recognizing warning signs of burnout. It would be mandatory for all corpsmen assigned to SEAL teams. When she presented the final curriculum to Morrison and the training staff, Senior Chief Vance was in the room. He had been quietly supporting her work, offering insights from his own 20 years of experience. "This is excellent," Morrison said after reviewing the materials. "When can we start the pilot program?" "Next quarter, sir. I have 6 experienced corpsmen willing to serve as test subjects. They will go through the full course and provide feedback for refinement." "Who are the test subjects?" "Volunteers from various SEAL teams who are between deployments. They have the experience to evaluate whether the training is realistic and applicable." Morrison approved the program on the spot. By the end of the week, Maya had her 6 volunteers, 5 men and 1 woman, all with multiple deployments and varying degrees of were showing in their eyes. The course began on a Monday morning. Maya stood before the 6 corpsmen and recognized something in each of them. The same driven intensity she had carried for 9 years. The same willingness to sacrifice anything for the mission. The same blind spots about their own mortality. This course exists because the Navy is losing talented corpsmen to preventable burnout, Maya began. You have all deployed multiple times. You have all saved lives under impossible conditions. And you are all on a trajectory to destroy yourselves if you do not learn to work differently. I know this because I was on the same trajectory until someone forced me to stop. One of the corpsmen, a wiry first-class petty officer named Torres, raised his hand. "With respect, ma'am, how do we know you understand what we face? No offense, but you have been in a training billet for months." Maya had expected this challenge. "Fair question. I spent 7 months in Afghanistan with a forward operating base. During that time, I sustained 7 combat injuries while maintaining a 0.4% patient mortality rate. I gave away my own pain medication to patients. I ran into active kill zones. I performed surgery while wounded. I did everything you are probably doing or planning to do. And I was pulled from deployment because I could not recognize I was destroying myself. This course is what I wish someone had taught me before I needed intervention." The room went quiet. Over the next 4 weeks, Maya taught them everything. How to assess their own stress levels using objective metrics. How to recognize when dedication became self-destruction. How to set boundaries without feeling like they were failing their patients. How to ask for help without shame. How to survive a career that wanted to consume them. She also taught them the medical skills they needed. Advanced trauma techniques. Unconventional resource management. High-stress decision-making. But always with the framework of sustainability. During week 2, Torres approached her after class. "I need to tell you something," he said. "I have been taking pain medication to get through my shifts for the past year. Nothing major, just enough to keep working when my back injury flares up. But I realize now that is exactly the kind of pattern you were warning us about." Maya felt a flash of recognition. That was her with the morphine. Her with the ignored wounds. Just a different substance, same underlying problem. "Are you still in pain?" she asked. "Every day. But I thought if I admitted it, they would pull me from my team. So I just managed it and kept going." "Torres, you need to see medical." A chronic pain condition that requires daily medication is not something you could just push through, and hiding it puts your patients at risk. I know that now. But what happens if they medically discharge me? Being a corpsman is all I know. Then you find a different way to be a corpsman. Training, research, program development. There are dozens of ways to serve that do not require you to work through untreated injuries. Torres went to medical the next day. The evaluation revealed a herniated disc that required surgery. He would be off deployment status for 6 months minimum. But the surgery would fix the problem instead of letting it deteriorate until permanent damage occurred. "Thank you," Torres told Maya after receiving his diagnosis. "6 months ago, I would have hidden this until I collapsed during a mission. You probably saved my career by convincing me to get help now." During week 3, the female corpsman in the course, second-class petty officer Chun, shared her own story during a group discussion about boundary setting. "I lost a patient 2 months ago," Chun said. "Traumatic amputation from an IED. I did everything right. Applied tourniquets, managed the bleeding, coordinated medevac. But he went into shock on the helicopter and died before we reached the hospital. I have been replaying that day constantly, trying to figure out what I did wrong, what I missed, how I failed him." Maya listened with complete attention. This was the grief she knew intimately. "Did the after-action review find any errors in your treatment?" Maya asked. "No." The medical review board said, "I performed flawlessly under extreme conditions." They said the patient's injuries were likely unsurvivable regardless of treatment. But you do not believe that. I cannot believe that. Because if I believe some patients cannot be saved, then what am I even doing? What is the point of this job if we just lose people anyway? The entire course was silent. Every corpsman in the room had faced this same crisis. The moment when perfect execution still produced death. Maya took a breath. "The point is that we save the ones we can save. That is all. Not all of them. Not every time. Just the ones where skill and supplies and timing align in our favor. We do not get to choose which patients are savable. We only get to choose whether we show up prepared and try our best. Sometimes our best is enough. Sometimes it is not. And neither outcome defines our worth as corpsmen." "But how do you live with the ones you lose?" Chen asked quietly. "By remembering the ones you save. By understanding that grief is appropriate but guilt is not. By recognizing that every patient you lose teaches you something that might save the next one. And by accepting that being human means having limits. Even ours." The course ended with a 7-Titwohor field exercise similar to what Maya had run for the SEAL candidates, but with different objectives. The corpsmen faced realistic casualties, resource limitations, and stress conditions. But they also practiced the self-monitoring techniques Maya had taught them. They took breaks when needed. They asked for support. They recognized their limits and worked within them. At the end, Captain Morrison evaluated their performance personally. "This is a different kind of resilience," he told Maya after reviewing the results. "They are not less capable. They are more sustainable. This is what we should have been teaching all along." The course became a permanent part of SEAL Team corpsman training. Maya was promoted to Hospital Corpsman First Class and designated as the program director. Her responsibilities expanded to include curriculum development for all Special Operations medical training at Camp Pendleton. 6 months after starting the instructor position, Maya received a letter from Corporal Davies. He had fully recovered from his surgery and returned to his team. His children had drawn pictures that he included with the letter. Stick figures of their father and a smaller stick figure labeled Doc Maya. "Thank you for saving my life twice," Davies wrote. "Once in Afghanistan and once in Germany. But more importantly, thank you for teaching me that asking for help is not weakness. I told my team about your lesson on sustainable service. It started a conversation that needed to happen. You're making a difference in ways you probably do not even realize." Maya put the letter and drawings in a frame on her office wall. Next to it, she placed a photo of Elena taken a month before she died. Below the photos, she added a small plaque with a quote she had written during therapy. "Honoring the dead means living well, not dying nobly." That evening, Maya met Senior Chief Ants for coffee at a cafe near the base. He was retiring after 22 years of service. moving to Oregon to be near his surviving family, starting the next chapter of his life. You changed the program, Vance said, in ways that will echo for decades. Every corpsman who goes through your training will be better prepared to have a full career. That is legacy. You helped, Maya replied. You saw what I could not see in myself. You pushed when I needed pushing. You probably saved my life. We save each other. That is how this works. They sat in comfortable silence, watching the California sunset through the cafe windows. Maya thought about the 9 years she had spent running from Elena's death, about the transformation from self-destructive hero to sustainable professional, about the choice to live instead of slowly die. Are you happy? Vance asked suddenly. Maya considered the question. Happy felt too simple for what she felt, but satisfied, yes. Purposeful. At peace. I am enough, she said finally. That is better than happy. Vance smiled. That is wisdom. Hold on to it. 1 year after beginning her instructor assignment, Maya stood in the Camp Pendleton Auditorium watching the graduation ceremony for her 3rd class of SEAL candidates. 18 young men who had survived BUD/S would deploy soon with their teams. All 18 had passed her tactical medicine course. All 18 knew how to save lives without destroying their own. Captain Morrison stood at the podium presenting certificates. Maya waited in the wings with the other instructors, her role in the ceremony minimal. She preferred it that way. The candidates were the heroes today, not her. After the ceremony, several candidates sought her out. Jackson, now graduated and assigned to SEAL Team 3, approached with his parents in tow. Doc Okonkwo, Jackson said, I want you to meet my family. Mom, Dad, this is the instructor I told you about. The one who taught me that being tough means knowing your limits. Jackson's mother shook Maya's hand with tears in her eyes. Thank you for taking care of my son. Thank you for teaching him to take care of himself. It was my honor, Maya replied. After the families dispersed, Maya found James Park waiting near the exit. He had rotated back from Afghanistan 2 months earlier and taken a position at the Naval Medical Center in San Diego. They had stayed in touch throughout her transformation. You look different, Park said as they walked across the base. Lighter somehow. I feel different. Therapy will do that. How many sessions are you up to now? 72. Weekly for the first 6 months. Bi-weekly since then. Dr. Chun says I am making exceptional progress. Are you still having the dreams about your sister? Occasionally. But they're different now. Less about watching her die and more about remembering her alive. I can think about Elena without it destroying me. That is progress. They reached the beach and sat on a low wall overlooking the ocean. The late afternoon sun painted everything gold. I have news, Park said. I am putting in my retirement papers. 20 years is enough. I'm going to open a clinic in my hometown. Serve the community. Maybe save some lives without the combat zone stress. That is wonderful. You will be excellent at it. I learned from the best. You showed me that burning out is not inevitable, that we can choose to serve in sustainable ways. I'm choosing differently now. Maya felt a surge of pride. This was the ripple effect she had hoped for. Not just teaching candidates, but influencing experienced corpsmen to value their own well-being. What about you? Park asked. Any plans beyond Camp Pendleton? I've been thinking about that. Captain Morrison wants me to develop a national curriculum, travel to other bases, train instructors across the special operations community, spread the sustainability model more widely. Are you going to do it? Probably. But I'm also considering something else. Going back to school, getting a degree in psychology or counseling, maybe specializing in military trauma. There are not enough therapists who understand what we go through. I could be useful in that space. You will be exceptional at that. Maya smiled. Senior Chief Vance said something similar before he retired. He told me I had a gift for seeing the damage people hide from themselves. Might as well use it professionally. They sat in comfortable silence, watching the waves. Maya thought about how different this moment was from the last time she sat on a beach contemplating her future. Then, she had been crying and broken. Now she was whole. A week later, Maya received an unexpected visitor. Commander Patricia Reeves, the psychologist who had evaluated her a year ago, arrived at Camp Pendleton for a follow-up assessment. This is a routine check, Reeves explained in Morrison's office. All personnel who undergo intensive psychological intervention receive annual evaluations. I need to confirm you have maintained your progress. Maya sat through the assessment with calm confidence. The same test that had revealed her maladaptive patterns a year ago now showed healthy stress responses, appropriate pain recognition, and sustainable behavioral patterns. When the evaluation concluded, Reeves reviewed the results with Morrison and Maya present. "The transformation is remarkable," Reeves said. "Your pain tolerance remains exceptional, but you now demonstrate appropriate responses to injury signals. Your stress management is within normal parameters. Your emotional regulation shows significant improvement. Most importantly, you exhibit none of the self-destructive patterns that concerned us previously." Morrison leaned forward. "In your professional opinion, is she fit for combat deployment if she chose to return?" Reeves looked at Maya for a long moment. "Yes, but I do not think she will choose that. She has found something more valuable here. Purpose without self-destruction. That is rare." "You are correct," Maya said. "I have no desire to redeploy. I am doing more good here than I ever did in Afghanistan." After Reeves left, Morrison pulled out another folder. "Maya, I need to show you something." He opened it to reveal a data summary. "Since you started the sustainability program, corpsman attrition rates in SEAL teams have dropped by 18%. Medical discharges due to burnout are down 23%. Patient mortality rates remain excellent, while corpsman injury rates have decreased significantly. You are literally changing the culture." Maya studied the numbers with wonder. 18% fewer corpsmen burning out. 23% fewer medical discharges. Those were careers saved, lives preserved, impact beyond anything she could have achieved by running into one more kill zone. "The Navy wants to expand your program," Morrison continued. "Not just special operations, all combat medical personnel. They want you to lead the development of a service-wide sustainment curriculum." "That is a significant undertaking," Maya said. "It is also a significant opportunity. You could affect thousands of corpsmen over the next decade, shape an entire generation of military medical personnel. This is the kind of legacy most people only dream of building." Maya thought about Elena, about the girl who had bled out while waiting for help that arrived too late, about the 9 years Maya had spent trying to make that death meaningful through her own suffering. This was different. This was actually meaningful. "I will do it," Maya said, "but I have conditions." Morrison smiled. "I expected nothing less. What do you need?" "I want Dr. Chun involved as a consultant. I want Senior Chief Vance brought back as an advisor, even though he is retired. And I want to include Petty Officer Park in the development team. He understands sustainability from the perspective of someone who nearly burned out and chose differently." Approved on all counts. The project consumed the next 6 months. Maya assembled a team of 12 experienced medical personnel, 3 psychologists, and 2 program development specialists. They researched, they tested, they refined, and they built a comprehensive system for sustaining combat medical personnel throughout their careers. The curriculum included early warning systems for burnout, peer support protocols, mandatory wellness checks, and consequence-free pathways to request help. It destigmatized therapy, normalized self-care, and reframed boundaries as professional standards rather than personal weakness. When they presented the final program to Navy leadership, Maya stood before a room of admirals and senior medical officers. She presented data, case studies, and testimonials from the corpsmen who had gone through her pilot programs. At the end of her presentation, a 3-star admiral stood. "Hospital Corpsman First Class Okonkwo." He said, "This is the most comprehensive approach to personnel sustainment I have seen in my 35 years of service. The Navy approves full implementation. Effective immediately, all combat medical personnel will receive this training. You have potentially saved hundreds of careers and thousands of lives. The Navy recognizes exceptional service. You are hereby promoted to Chief Petty Officer and awarded the Navy and Marine Corps Commendation Medal for your work in program development and instruction." The room erupted in applause. Maya stood at attention, overwhelmed by the recognition, but also by the realization of what it meant. Chief Petty Officer, a rank she had never imagined achieving. a medal for saving lives without dying in the process. After the ceremony, Dr. Chen found her in the hallway. "I am proud of you," Chen said. "When we started therapy 18 months ago, you could not imagine a future where you were not constantly in crisis. Look at you now, thriving, leading, changing an entire system. I could not have done this without you. You did the hard work, Maya. I just provided the space for you to figure it out. Speaking of which, have you thought more about going back to school for psychology?" "I have. I am applying to graduate programs this fall, focusing on military trauma and resilience. I figure if I'm going to spend my career helping people heal, I should get properly credentialed for it." Chen smiled. "You're going to be an exceptional therapist. You have lived both sides, the breaking and the healing. That perspective is invaluable." That evening, Maya drove to the cemetery where Elena was buried. She had not visited in months. The grave was well maintained, flowers fresh from their mother's regular visits. Maya sat in the grass and pulled out the commendation medal. "I did it, Lena," she said quietly. "I found a way to make your death mean something without destroying myself. I am saving lives. Lots of them. But I am also living. Really living. I think you would be proud of that." The wind rustled through the trees, carrying the scent of jasmine from nearby plantings. "I'm going to be okay now. Better than okay. I'm going to help other people be okay too. That is how I honor you. Not by dying the way you did, but by living in a way that prevents others from dying unnecessarily." Maya stayed until sunset, then drove back to Camp Pendleton. Tomorrow she would start training the next generation of instructors in her sustainability program. The work would continue. The impact would grow. And Maya Okonkwo, finally at peace with herself and her purpose, would be there to guide it. 2 years after accepting the instructor position at Camp Pendleton, Chief Petty Officer Maya Okonkwo stood in front of 300 corpsmen at Naval Station Norfolk. The auditorium was packed with medical personnel from every branch of service. They had gathered for the national launch of the Combat Medical Sustainment Program that Maya had spent 18 months developing. The program was no longer experimental. It was official Navy policy. Maya adjusted the microphone and looked out at the sea of faces. Some skeptical, some curious, all waiting to hear what she had to say about surviving a career that consumed most people who entered it. 5 years ago, Maya began, I watched my younger sister bleed to death on our apartment floor. I was 18. I had minimal medical training. The ambulance arrived too late. She died, and I decided that I would become the person who saved everyone else. I enlisted in the Navy 2 weeks after her funeral. The room was absolutely silent. For 9 years, I tried to save my sister by saving strangers. I volunteered for the most dangerous assignments. I ignored my own injuries. I gave away my pain medication. I ran into kill zones. I did everything possible to prove that I was the corpsman who would never fail anyone the way I believed I had failed Elena. And I nearly destroyed myself in the process. Maya paused, letting the words settle. I am standing here today because someone saw what I could not see in myself. That my dedication had become self-destruction. That my pain tolerance was not strength, but damage. That I was on a trajectory to die heroically instead of live purposefully. The Navy pulled me from combat deployment and forced me into therapy. I was furious. I felt like a failure. I believed that if I was not bleeding for my patients, I was not worthy of being a corpsman. She saw nods of recognition throughout the audience. These were her people. They understood. It took me 6 months of intensive therapy to understand a simple truth. Saving lives is not about sacrifice. It is about sustainability. The best corpsman is not the one who dies for their patients. It is the one who lives long enough to save hundreds of patients over a full career. You cannot help anyone if you burn out, break down, or get yourself killed trying to be invincible. Maya clicked to the first slide. Statistics on corpsman attrition rates, medical discharges, and burnout patterns. These numbers represent talented medical personnel we are losing. Not because they lack skill or dedication. Because we have created a culture that glorifies self-destruction and mistakes exhaustion for commitment. That culture is killing our people. This program is designed to change it. Over the next hour, Maya presented the full curriculum, the warning signs of burnout, the protocols for seeking help without career consequences, the peer support systems, the mandatory wellness checks, the reframing of boundaries as professional standards. She also presented the results from the pilot programs. Attrition rates down 27%, medical discharges down 31%, patient outcomes maintained or improved, corpsman satisfaction scores significantly elevated. The data was undeniable. The program worked. During the question period, a young second-class petty officer stood. "Ma'am, what do you say to people who think this makes us soft, that we should be able to tough it out?" Maya had heard this question dozens of times. "I say that toughness without wisdom is just stubbornness. Yes, we need to be physically and mentally tough, but we also need to be smart enough to recognize our limits. A corpsman who works until they collapse is not tough. They're a liability. Their patients deserve better. Your team deserves better. And you deserve better." After the presentation, Maya was approached by a captain she did not recognize. He introduced himself as the commanding officer of a Marine Expeditionary Unit. "Chief Okonkwo, I want to thank you personally. One of my corpsmen went through your sustainment course 3 months ago. Last week, he came to me and said he was struggling with nightmares from his last deployment. He asked for help. 2 years ago, he would have hidden it until he broke. Your program gave him permission to be human. That probably saved his career and maybe his life." Maya felt the familiar warmth of impact. "That is exactly what we are trying to achieve, sir." The national tour continued for 6 weeks. Maya presented at 8 major military installations, trained 47 instructors, and personally spoke with hundreds of corpsmen. The message was consistent. You're not weak for having limits. You're a professional for recognizing them. Between tour stops, Maya continued her graduate studies in clinical psychology. She attended classes online, wrote papers during flights, and somehow maintained her therapy practice with Dr. Chin. The workload was intense but sustainable. She had learned the difference. During a stop at Naval Medical Center San Diego, Maya encountered a familiar face in the hospital corridor. The young Marine she had given her morphine to in Afghanistan. He was walking without a limp, looking healthy and whole. "Doc Okonkwo," he said, recognizing her immediately. "I heard you were here. I wanted to thank you again for what you did." "How are you doing?" Maya asked. "Good. Really good. I got fitted with a prosthetic that works great. I am training other amputees now, helping them adjust. Your example, the way you took care of me when I was terrified, that stuck with me. I wanted to pay it forward. That is wonderful. I am glad you found your purpose. I wanted you to know something else. I have 3 younger siblings. 2 of them are considering military service. I tell them about you every time. About the corpsman who gave me her pain medication because she knew I needed it more. You changed my life that day, not just by saving it, but by showing me what real strength looks like." After he left, Maya stood in the corridor feeling the weight and wonder of legacy. That single decision in a field hospital 2 years ago had rippled outward in ways she never could have predicted. The final stop on the tour was Camp Pendleton. Maya returned to her home base to find a surprise waiting. Captain Morrison had arranged a ceremony. In the base theater, 200 people had gathered. SEAL candidates she had trained, instructors she had mentored, corpsmen who had gone through her sustainment program. And in the front row, her mother sat beside an empty seat, the seat that would have been Elena's. Morrison took the stage. "Chief Petty Officer Maya Okonkwo has fundamentally changed how the United States Navy approaches combat medical sustainment. Her work has prevented countless cases of burnout, saved careers, and quite literally saved lives. The Secretary of the Navy has authorized a special recognition for her contributions." He opened a case containing the Navy and Marine Corps Achievement Medal. This honor recognizes sustained professional achievement and dedication to the advancement of Navy medicine. "Chief Okonkwo, your sister's death was a tragedy, but the work you have done in her memory has created a legacy that will outlive all of us. You have turned grief into purpose, pain into progress, and personal trauma into systemic healing. The Navy is grateful. I am grateful. And I suspect Elena would be proud. Maya accepted the medal with tears streaming down her face. She looked at her mother, who was crying openly. She looked at the faces of the corpsmen she had taught and trained and helped. She felt the weight of 2 years of transformation, of choosing life over martyrdom, of learning that saving herself was not selfish. After the ceremony, Maya's mother embraced her tightly. "Elena would be so proud of you," she whispered. "I am so proud of you. You took the worst thing that ever happened to our family and made something beautiful from it." That evening, Maya stood alone in her office at the training center. On the wall hung the drawings from Corporal Davies' children, the photo of Elena, the plaque about honoring the dead by living well, and now, 2 medals representing recognition for choosing a different path. Her phone buzzed. A message from Dr. Chun. "I saw the ceremony photos. Congratulations on the medal and on becoming the person you needed when you were 18. That is the real achievement." Maya smiled and typed a reply. "Thank you for helping me get here, for teaching me that healing is not weakness and boundaries are not failure. I cannot have done this without you." Chin's response came quickly. "You did the work. I just held space for it. Speaking of which, I have a proposition. My practice is expanding. I need an associate who understands military trauma. Interested in joining when you finish your degree?" Maya stared at the message. The offer represented everything she had been working toward. A future beyond instruction. A career dedicated to helping others heal the way she had healed. She typed her answer. "Yes, absolutely yes." Maya looked out her office window at the Pacific Ocean. The same view she had seen 2 years ago when she was broken and afraid. The same water that had witnessed her transformation. She thought about the corpsmen graduating tomorrow who would deploy with better tools for survival. About the instructors spreading the sustainment message across the military. About the lives that would be saved not through heroic sacrifice, but through sustainable practice. She thought about Elena, forever 16, whose death had launched Maya on a 9-year journey of self-destruction that had finally transformed into healing. If you enjoyed this story, drop a comment and let us know your favorite moment, or share if you have witnessed someone show extraordinary strength by choosing to heal instead of destroy themselves. Maya picked up her phone and sent one more message. To James Park, to Senior Chief Vance, to Corporal Davies, to every person who had been part of her journey. Thank you for saving me when I could not save myself. The responses came quickly. Variations on the same theme. We are proud of you. You earned this. Keep going. Maya turned off her office lights and walked out into the California evening. Tomorrow she would teach another class. Next month, she would present at another base. Next year, she would finish her degree and begin a new chapter. But tonight, she simply walked along the beach, feeling the sand beneath her feet and the ocean breeze on her face. Chief Petty Officer Maya Okonkwo had spent 9 years trying to save her sister by destroying herself. She had spent 2 years learning to save herself by helping others. And she had finally discovered that the second path was the one Elena would have wanted all along. The one that led not to a heroic death, but to a meaningful life. She was enough. She had always been enough. And now, finally, she believed it.